Now we are moving towards the second section, that is the tumor-like condition. As the name suggests, they're not actually tumors. They're outgrowths from the bone and usually may present as a mass, but they are termed, any outgrowth can be termed as tumor, but usually they are not actually tumors. Rather, they are benign conditions which usually present like a tumor. And these includes multiple hereditary exostosis and dysplasia epiphysealis hemimelica, and we'll be going through these two only, and in the next section we're going through enchondromatosis and fibrous dysplasia. So what is multiple hereditary exostosis? As the name suggests, multiple means there are multiple they are present in multiple parts of the body. Hereditary, it means it has a genetic component. Exostosis is actually outgrowth of the bone. If you see this X-ray, isn't this proximal tibia outpouching of the bone can be seen over here. If you see this, there may be swelling of the bone in the fifth metacarpal. Similarly, over here as well in the phalangeal area as well. On the right side, this is multiple areas involving the metacarpal phalanx. On the left hand, it's only one of the metacarpal is involved. Usually, these conditions actually present with multiple outgrowths from the bone. And these include multiple hereditary exostosis, dysplasia epiphysealis hemimelica, which is actually epiphyseal hereditary exostosis, then enchondromatosis and fibrous dysplasia. What are the features? Usually they present actually this, as the word it is, it's actually a bony outgrowth with a cartilage cap. So it's a cartilage cap benign bone tumors involved. The genes which are involved is exostosis gene, which is X type 1, type 2 and type 3 gene. Then majority are autosomal dominant in a pattern of inheritance usually, and this may present as uncontrolled transverse growth of growth plate. Usually the most common area is metaphysis area. Around the knee joint is the most common, especially the distal femur and the proximal tibia. They may present as outpouchings or growth of the bone from the near to the physis and in the metaphyseal area. They may be multiple in a single bone. They may also be present in other bones as well of the body. In discrete peripheral, these are discrete peripheral cartilaginous masses. The important point is, although they're bony outgrowths, but they have a cartilage cap over them. And usually what results is they start from usually metaphysis, and they actually tend to grow outward, that is away from the physis. If you see this diagram, this is a kind of an exostosis present right over the ileum in the pelvic. Although this is a rare location, but they can be present anywhere. Clinically features, as if you see this limb, can you see these growths which is probably involving the metaphyseal region of the proximal tibia? Similarly, involving this leg as well and producing deformities. Usually they produce local symptoms, that is locally there will be swelling, although it will be painless, but it will be bony hard swelling. Then there may be physeal teething as well, which may be seen on the x-ray. Then usually results in, if they are present in around the knee, this may be leading to differential tubercular growth and eventually leading to LLD, that one leg may be short as compared to the other end. So as they're usually present on the metaphysis, that is they are periarticular, and they may present with joint deterioration. If they are present radius ulna, multiple exostosis, the radius ulna can present with ulnar shortening or radial deviation and subluxation of the radial head. And they may be usually present with multiple exostosis may be present without any skeletal deformity, or they may be present in the spine, eventually creating some kind of spinal deformities as well. There is almost 1% chance of these, as they have a cartilage cap, so they can develop into a variety of a sarcoma called as chondrosarcoma. In this, how do we diagnose them? The diagnosis is very simple. There will be multiple outgrowths multiple exostosis in the skeletal surface done. Usually a patient may have multiple outgrowths in the distal femur, proximal tibia. There may be similar kind of outgrowths in the humerus, in the radius ulna, and in the vertebral column as well. Now, if you see these three x-rays, this is a rare type exostosis can be seen over here in the first metatarsal. This is where usually the common occurrence that this is osteochondroma of can be seen over here. In the metaphyseal region, they may be present in the ileum or some other parts of the body as well. So the most importantly, the X-ray is actually the first thing to get done, and most likely we know that it's mostly multiple lesions which are present in the skeleton. The next is the CT, which actually tells us that most likely it's the lesion of the bony origin, and then MRI would actually differentiate it, because MRI would tell us that whether there is associated cartilaginous cap as well or not, and if it has a cartilaginous cap, how thick it is. So actually MRI is pathognomic for this kind of diagnosis of this disease. They may be divided into two types. If you see this over here, this is a pedunculated variety, because they have an outgrowth in like a peduncle, but sometimes they're sessile, that is, it is mostly lies flat on the bone, but still it appears an extra osseous growth from the metaphyseal region. Usually these lesions are in the metaphysis of the distal femur, proximal tibia, and proximal humerus, but that does not mean that they cannot be present anywhere else. They can be present in the vertebrae, usually the pelvis, mostly in the radial region as well. So, but most commonly they are found in the distal femur, proximal tibia, and proximal humerus. So, how do we diagnose? We diagnose it with the use of X-rays. Simply the plain radiographs will tell us. Then CT scan will tell us whether it's actually a bony outgrowth or not, and then MRI will tell whether the cartilaginous cap is present or not, and how much thick it is. Then coming to the, depending upon if there are multiple, usually they are not excised until unless they become symptomatic. But if they become symptomatic, that is painful, then we have to get an open biopsy to rule out the chances of chondrosarcoma. Although it's very rarely to get 1%, less than 1% chance of developing into chondrosarcoma, but we must remember that they can develop into chondrosarcoma. So the treatment is actually excision. That is present in the distal femur and the proximal tibia. That is simply excise them and send them for biopsy. And excision is indicated in case it is actually causing restricted joint movement. Then now it has become symptomatic. It's causing neurological or vascular compression. It's causing an angular deformity at knee. It may be causing a joint malalignment or limb shortening or malignant transformation. If we are suspecting that it has transformed into a malignant structure, then we may have to get an open biopsy and send it for examination of a biopsy for histopathology. Now coming to a rare disease which is called as Dysplasia epiphysealis hemimelica. It's actually a rare form of variety because these usually and multiple hereditary exostosis are usually seen in the metaphysis. But in epiphyseal osteochondromatosis, if this is termed as Dysplasia epiphysealis hemimelica, because it's osteochondroma means it's a bony outgrowth which a cartilaginous cap. If it is present on multiple areas, then it can term the multiple hereditary exostosis. Otherwise, it's called as epiphyseal osteochondroma. Usually, as the name suggests, they are present in the epiphysis. This lesion may be formed in the medial lateral aspect of the epiphysis. Usually sporadic in disorder, and most commonly they are around the knee. That is involving the distal epiphysis of the femur. Cartilage overgrowth, actually they are almost kind of similar tumors, that they are bony outgrowth with a cartilaginous cap over it. Symptoms, as now they present with usually symptoms because as they're in epiphysis, they may they directly protrude into the joint and may cause symptoms very early. On the other hand, multiple hereditary exostosis may be asymptomatic for years, and maybe one of the nodule may be presented with symptoms sometimes. Sometimes they do not present with symptoms at all, rather it's an incidental finding. Symptoms of this epiphyseal disease includes restricted joint movement, palpable intra-articular limb, asymmetric limb deformities, and visible exostosis, which may be present as well. MRI CT scan assesses size, position of the lesion, and shows corticomedullary continuity, whether they are continuous with the medullary cavity or not, and what is the state of the cartilaginous cap which is present over them. Now that would dictate eventually the management is almost the similar for both of them. That is, if it is inside the joint, you have to take it out. Asymptomatic patient, even if the patient is asymptomatic, that also needs excision because this is actually now entering into the joint. But if it is already symptomatic, then the treatment is excision. Simple large lesions usually sometimes present with secondary deformities, and once the excision is being done, for example, this may be associated with LLD, they may associate with angulation of the knee, then it's not only excision but post excision we have to do something about the angulation deformity as well, and sometimes maybe proximal tibial osteotomies may be needed to correct the angular deformity following excision of this tumor. In this section, we are going through the tumor-like conditions, and we have gone through multiple hereditary exostosis and epiphyseal osteochondromas. Keep watching sqadia.com. Thank you very much.